What if the very organ that keeps you alive suddenly stopped working? And what if the only way to survive was to replace it with someone else's? Sounds like science fiction, right? But this isn't a movie, this is real medicine. Today, we're diving deep into one of the most complex, life-saving procedures in modern healthcare: liver transplant surgery. From how doctors decide who needs it, to the breathtaking process inside the operation theater, and what life looks like after, this video will reveal secrets you've never heard before. Stay tuned, because the truth about liver transplants will surprise you. Part 1: Why liver transplants are needed. The liver is the body's detox powerhouse. It processes toxins, helps digest food, regulates blood clotting, and stores essential nutrients. But diseases like cirrhosis, hepatitis, fatty liver disease, or sudden acute liver failure can damage it beyond repair. In severe cases, medication no longer helps. The only option is a transplant. Over 30,000 people worldwide are waiting for a liver transplant right now, but only a fraction will get one due to shortage of donors. This creates the first big question: who gets the transplant first? And that's where the MELD score model for end-stage liver disease comes in, a system doctors use to prioritize patients based on how sick they are. Part 2: Donor selection. Liver transplants can come from deceased donors, someone who has passed away but donated their organ, or living donors, usually a family member donating part of their liver. Unlike other organs, the liver is unique. It regenerates itself. Even if a donor gives away up to 60% of their liver, it grows back to full size in a few months. Doctors look for perfect blood type match, liver size compatibility, and overall donor health before deciding. Here lies the curiosity factor. Did you know? In some rare cases, a child's tiny liver can be split, with one part saving another child and the other part saving an adult. Part 3: The surgery process. This is where the magic and the risk begins. Step 1: Anesthesia and incision. The patient is put under general anesthesia. Doctors make a large incision in the upper abdomen. Step 2: Removal of diseased liver. The failing liver is carefully disconnected from blood vessels and bile ducts. Step 3: Implanting the new liver. The healthy donor liver, or part of it, is placed inside and connected to blood vessels. Step 4: Restarting the blood flow. As blood starts flowing through the new liver, it literally begins to come alive. Surgeons often describe this moment as the most dramatic. The organ turns pink and starts functioning almost instantly. Step 5: Closure. Doctors connect bile ducts, check for leaks, and close the incision. On average, this surgery can last 6 to 12 hours and requires a team of up to 20 specialists working together. Part 4: Risks and recovery. Any major surgery has risks: bleeding, infection, or blood clots, but the biggest concern in transplants is organ rejection. The immune system sees the new liver as a stranger and may attack it. To prevent this, patients must take immunosuppressant medications for life. Recovery. Hospital stay: 2-3 weeks full recovery, 3-6 months survival rates. About 90% of patients live at least 1 year after transplant, and nearly 75% live 5 years or more. Part 5: Life after liver transplant. Patients can go back to normal life, working, exercising, and even enjoying favorite foods. In moderation, regular checkups are necessary, but most people report a massive improvement in quality of life compared to before surgery. Fun fact: some people notice changes in taste and energy after the transplant because their new liver metabolizes things differently. Part 6: The future of liver transplants. Researchers are working on artificial livers, stem cell therapy, and even lab-grown organs to solve the donor shortage crisis. In the near future, patients might not have to wait years for a donor. Science could literally imprint a liver for them. Liver transplant surgery is more than just a medical procedure. It's a second chance at life. Every successful transplant isn't just about saving one person. It's about restoring hope for entire families. If this video helped you understand the power of modern medicine, make sure you hit subscribe and join our community. Because in the next video, we're diving into another life-changing surgery that could affect someone you know. Stay curious, stay healthy, and I'll see you in the next one.